بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أنا دكتورة عزة عمر الفاضل. Good morning. Today inshallah we will continue our course Advanced Infection Control Lecture 4 Transmission Based Precautions. الاحتياطات دي احتياطات إضافية وزي ما قلنا اسمها Additional Precautions بالإضافة إلى Standard Precautions، بتعتمد على حسب نوع المرض أو حسب طريقة انتقال المرض. Learning objectives, understanding what TBB are and purpose of transmission-based precautions, understand and why they are needed, know the three types, contact, droplet and airborne precautions, recognize which infections required each type, apply proper patient placement and signage, ensure safe patient transport, communicate precautions clearly to staff and visitors. Transmission-based precautions are the second tier of basic infection control and are to be used in addition to standard precautions for patients who may be infected or colonized with certain infectious agent, for which additional precautions are needed to prevent infection transmission. قلنا هي didn't replace a standard precaution, it's added in addition to standard precautions. وده في حالة إنه standard precautions فشلت في إنها تحتوي لي المرض أو contain المرض. Precautions may be used separately or in combination depending on the disease involved. في بعض الأمراض بنحتاج إنه نطبق نوعين اللي هي contact مثلا precautions زائد droplet precautions. واحد airborne precautions اللي هي الاحتياطات الهوائية by dissemination in the air of droplets nuclei less than 5 micrometer containing the infectious agent. There was new classification for airborne transmission by Rowe and Melton. Obligate, example tuberculosis, and obligate means transmitted through airborne only, preferential through like measles and varicella. The main mode of transmission is through air but can transmit through droplet like in some process like suctioning and bronchoscopy. Opportunistic like avian influenza and SARS virus. This can transmit in special situation like crowded environment, closed area, in poor ventilation area. It can transmit through airborne, but it mainly transmits through droplet transmission from the environment. Anthrax spore of the environment. We know that the spores can survive in the environment for a long time, and during cleaning or by dry mop, for example, and when there was construction or renovation, this spore can transmit by airborne to the personnel in the healthcare. In the last old classification, they mentioned airborne just transferred by airborne and droplet just transferred by droplet. It was rigid and non-flexible, so they mentioned this new classification. Airborne precautions protect from disease spread by air or respiratory tract, primarily used for suspected or diagnosed TB. A special ventilation room, negative airflow is required, door is kept closed, a power air purifying respirator PAPR is required to enter the room. Some area, surgery, MRA, wear N95 mask, wear. An annual fit test is required for N95 respirator. Okay, this is science for airborne isolation room. It's put it in the entrance of the room. It contains precautions for visitors, for hand washing, and suitable PPE should be used before and when leaving. Visitors please wear mask prior to entering room. Always remove powered air purifying respirator or N95 mask, and wash hand when leaving the patient environment. Room, private room, door must be closed. Glove and gown not required. Mask, powered air purifying respirator for staff, and N95 mask for others. Wash hand with soap and water before leaving the patient environment. Patient wear surgical mask when out of room. Follow respiratory hygiene or cough etiquette. If skin lesions are present, cover lesion with clean sheet. Healthcare worker wear BABR when entering room, and handling patient may remove BABR once out of the room, and patient is wearing mask. Hand hygiene prior to transport, and clean medical equipment after use. طيب airborne contact precaution. قلنا مرات بنحتاج لcombination للprecautions airborne مع الcontact use for other occasion when special ventilation room is required اللي هي negative pressure room is needed. Example, varicella, chickenpox, measles, shingles in an immunocompromised patient. This condition is also spread by contact, so contact precautions are required. Okay, here we use negative pressure room. The pressure inside is lower than outside. Board air purified respirator from inside to outside. Then gown and gloves are required to enter. Precaution door should be kept closed. Droplet precautions. وقلنا دي droplets contain microorganisms come in contact with mucous membrane. Droplet أكتر السايز بتاعها أكتر من 5 micrometer, so this distribution is limited by the force of expulsion and gravity, usually 1 meter or less. بتمشي لمسافات بسيطة اللي هي من 1 ل 3 feet اللي هي 1 meter. For that reason, droplets settle down, not remain suspended in the air. Special ventilation system are not required. يعني محتاج negative pressure. Droplet precautions protect against disease spread by respiratory droplet, including Neisseria meningitidis اللي هو bacterial meningitis of unknown origin, bacterial viruses, influenza, pertussis اللي هو whooping cough. A surgical type mask is required to enter the room. The size of a droplet, isolation of droplet precautions بيكون فيها قلنا instruction of precautions should be followed by visitors. Please wear mask prior to enter room. Always remove mask and wash your hands when leaving the room. Patient room, single private room, and door may be open. Gloves not required, gown not required, mask required when entering the room. Examples, influenza and meningitis. Droplet isolation, transport of patient. Patient wear surgical mask when out of room. Follow respiratory hygiene, cough etiquette. Healthcare worker wear mask when entering room, may remove mask once patient is wearing a mask. Healthcare worker does not need to wear mask during transport. Equipment زي الويلشير بنعمل لها cleaning, الاستيثوسكوب, الجلوكوميتر, كل الميديكال equipment يعني it come in touch to the patient or in contact with patient, we should clean it. Okay, contact precaution apply to specified patient known or suspected to be infected or colonized with epidemiologically important microorganism that can be transmitted by direct or indirect contact. Direct contact, direct physical transfer of microorganism from an infected person to susceptible host. Indirect contact, transmission, contact with contaminated objects such as contaminated equipment or instruments اللي هي patient surround. Type and contact isolation, protect from disease spread by contact, including Clostridium difficile. قلنا الكلوستريديوم ديفيسيل من أصعب المايكرو أورجانيزم حتى في الديسنفكشن، يعني الهايبوكلورايت اللي يكون بتركيز عالي لأنه عندها السبور. قلنا السبور كان withstand الديسنفكشن. Clostridium difficile escape slice in Betico, patient with multiple drug resistance, MDRO, like MRSA, VRE, and MMDRO microorganism. Pseudomonas acinetobacter, private room required, gown required, and glove required. طيب دي contact isolation signs. بالنسبة للvisitors, please wear gown and gloves prior to entering the room. Always remove gown and gloves and wash your hands before leaving the room. طيب المفروض يكون في private room، يعني it's recommended to have a private room. طيب wear glove and gown before entering room. الماسك when only if intended، يعني ما من الحاجات إلا إذا كان في ضرورة. wash hands with soap and water or alcohol based hand rub. وقلنا في حالة الكلوستريديوم deficiency بنغسل ب soap and water because السبور أو الكحول not effective against السبور. طيب بالنسبة للpatient transport, patient wear clean gown, cover any open wound. Patient with clean sheet prior to transport. Healthcare worker wear personal protective equipment PPE. When touching patient, remove and dispose of PPE. Perform hand hygiene prior to transport. Patient don't clean PPE to handle patient at transport destination. طيب visitors who are not providing direct care to patient, no need to wear glove and gown. Also student and healthcare worker not come in contact with a patient. Equipment cleaning, glucometer, thermometer, stethoscope, any medical equipment can come in contact or in touch with patient. PPE and hand hygiene, patient transport, patient care equipment, and environmental measures. This table summarizes transmission-based precautions, droplet, contact, and airborne precautions, which suitable PPE should be worn, and hand hygiene. Patient placement, single room with hand washing toilet and bathroom facility, cohort with patient with same pathogen. طيب cohorting, if no single private room for patient need, contact isolation cohorting same patient with same infection in a ward. And do this, ensure physical separation اللي هي أكتر من 3 feet اللي هي 1 meter 3 feet. Draw the privacy curtain between beds، باخد فواصل between البeds. Change protective attire and perform hand hygiene. بطلع البروتكتيف attire وبعمل hand hygiene. Exclude patient who have condition that may increase the risk of adverse outcome from infection or that may facilitate the transmission. Those who are immunocompromised, who have open wound or have anticipated prolonged length of stay. Summary, isolation precautions and the use of PPE are designed to reduce the risk of transmission of microorganisms from both recognized and unrecognized source of infection in hospital. Okay, references CDC, WHO. Thank you very much for your patience.
Now I'm recording.
Stay healthy.
Great.
Stay healthy.
Great. Now I'm recording.
Stay healthy. Stay healthy.
Great.
Stay healthy.
Good. Great. Less loud.
Are you recording?
Yeah.
Stay healthy.
Louder.
Stay healthy.
Louder.
Stay healthy. Are you recording?
Yeah.
Stay healthy.
Louder.
Stay healthy.
Louder.
Stay healthy.
Nothing.